would like to start the proceeding now. Here with us today, I would first like to welcome each and every one of us to this very historical event, the beginning of we achieving a health service here in Negril that is worthy of the community. Dr. Ken Garfield Douglas and his team from Western Regional Authority, staff of the Negril Health Center, members of the Negril Chamber of Commerce, Negril stakeholders, and visiting friends. I also extend the greetings and acknowledge the apology from the Honorable Dr. Christopher Tufton, Minister of Health, Dr. Wickham McNeil, MP, who are unable to be with us this morning due to prior planned engagement. A pleasant welcome to all and good morning. Today is a great day for us here in Negril. Over the years, we have bemoaned the fact that Negril is always being left out when it comes to the infrastructural development of the area. We have come to the reality that things will only get better when we, the resident, leads the way. Today is a step in the right direction. It is important that we have a functional, up-to-date clinic here in Negril, one that is capable of delivering first-class medical care that is acceptable to all its residents. For us to achieve this, we cannot rely on government alone. This calls for a united effort by the private and public sector. This includes all of us, business, individual, large and small. Mr. Lee Issa, as our president for the last 2 years, has led the charge for us to have a first-class clinic here in Negril. We were informed by the authorities that it will cost close to 150 million, and they alone could not afford it. Hence, our then president committed us to raise $100 million towards the cost. On behalf of the Chamber, I would like to extend our gratitude to our immediate past president, Mr. Issa, and his team from Couples Resort for making our gala dinner and silent action 2017 a success. I would also like to thank Miss Gail Jackson Brooks and her husband Jesse Brooks of Negril Treehouse for hosting the Negril Golf Scramble 2017. It is the proceeds of these events that we will be presenting today to the Negril Health Center Building Fund. The NCC will continue to host these and other fundraising events, such as our International Food and Wine event, the brainchild of our first Vice President, Mr. Richard Wallace, and other fundraisers such as our annual gala dinner. We encourage our community and visitors to support these indicatives, as all proceeds will go to the worthy cause that will eventually benefit us all. We have to be the change that we seek for Negril. The expansion of the Negril Health Center is just one step closer to making our resort town ideal. If you truly love Negril and share the same passion and vision the Chamber has for this community, then join us by giving to this worthy cause. Our aim is to raise 150 million Jamaican dollars, that is, before we start the building process. Today, we are at 1,800,000 to help us reach this goal. The account numbers for the Negril Health Center building funds are US, get your pen down, 830-912. That's for the US account. For the Jamaican account,
It says 1-1.
for the Jamaican
For the
account,
Jamaican account is
it's
11.
830-911 Scotiabank, Negril. We can make it happen, ladies and gentlemen. We mustn't look on the distance we're going. We just look and making the first step. This is our first step. Negril can be an attractive resort, not just for the tourists, but providing quality service for our residents. Together, we can do it. And we call on all of you to go and spread the words to make sure that this is a reality. We can do it and we will do it. Thank you all very much.
Amen.
Daniel, check.
The check.
Plus, I get 30,000 storage.
By the way,
That number's not right now.
Okay. Can we have somebody from the health center to accept the check, please?
yes, now it's you to present.
You can't spend it, it's not yours.
Wait,
On behalf of the Negril Chamber of Commerce, this is the first in a series of steps that we are going to be taking over the next year to raise 150 million Jamaican dollars to make the new health center of Negril a reality.
okay, all right.
I think also Mrs. Brooks has a presentation today.
Okay, go back there. $30,000 from the golf scramble. This was a, I'm sorry. Anyways, this was a donation given from Zimbabwe Retreats as one of the sponsors for our golf scramble in the grill. So 30,000 on top of that.
Yeah, look this way.
Thank
The
you.
fund started to grow.
The fun's going good.
Is there anybody here from Woodstock?
Okay,
Okay, great.
I guess.
There is a check also from Woodstock.
Yes. I would just like to thank Mr. Powell and the team from Woodstock, who has agreed to give part proceeds from his Barry's Hammond concert. He has today with us a check for $300,000 towards the health center. Thank you very much, my friend.
Thank you.
Thank you.
Good.
Yeah.
Wait.
Could you hand it to
Hello. Okay. Can you turn this way, please? Wait. No, could you another? No. I want you both. Please. Thank you. Thank you.
You want to say?
Okay. We have with us today a donation pledge, which I will be handing out, and it has all the details of how you can make a donation to this fund. It doesn't matter how small it is, we won't refuse anything. This is a community effort. We're no longer going to be happy to sit back and says the government don't do this and the government don't do this. We're going to show the way and hope that they will follow. So please feel free to donate whatever you have. Don't be afraid. There is the bank account. You can go once a month, once a year, once a week to make whatever donation you can.
Just put their name on the back.
I want to say something about the registry.
You want to come and explain the registered?
So the people who can contribute.
Okay.
Andrea has a very good idea that she would like to.
All right, several ideas, guys, for us to, ladies and gentlemen, I should say, sorry, for us to make a meaningful contribution to this worldwide cause. There are several. One, I'm suggesting that we put a container in the bank as well and other locations. And if we could get more extensions like these to put there as well, these pull up to put there as well, so persons will be attracted to give. And also we will put beside those containers a logbook So you can put your name, your amount, and your telephone number in case you need to get through. So that's one way. Also, we encourage you to make the deposits to the accounts here in Jamaica and US as well. We're also looking at opening a PayPal account that you can make contribution online to pay to your PayPal, and then PayPal in turn will send the money to the account here in Jamaica. So we're looking at that as well. So there are 3 means that you can get. 1, deposit straight to the account. 2, go into the bank, put the money in a container, or other locations. So I look at the hotels too, certainly, so we could put containers there so the tourists can make a contribution and put these there as well to draw their attention to it. So those are the 3 ways we're looking at.
Okay.
And I'm sure if more comes up, we will advise that guys.
And we will be from time to time, maybe a quarterly basis, issuing a statement as to exactly where the fund stands.
Exactly.
So people
Very
can
good.
see where the money is and know how close or how far we are away from it. So we will make that public. I suppose we'll be having it on the Negril website to say exactly where we are. At this moment, there is nobody here from the press. So, Mr. Issa, you will do the closing remarks.
I want to thank everybody, first of all, for coming. And I would like to take a moment to commend the Minister, Christopher, for initiating the Adopt a Clinic program. I think it is something that's well needed if we're going to improve healthcare in this country. I think our hospitals are bursting at the seams. I think they have a hard time coping with the amount of patients that come to the hospitals on a day-to-day basis. These clinics that are going to be upgraded across the length and breadth of this country will help to alleviate the pressure on a lot of our hospitals so that they can continue to give top-class medical care to the patients that come there. So we are very pleased, the Chamber of Commerce is very pleased to be part of this initiative, and where it would be nice if we had a major sponsor or 2, we're not waiting for that. One Coca-Cola basket, we will get there. It might not be tomorrow, it might be not next month. If it takes a year, I feel very strongly that we are going to meet the target of 1,250,000 US or 150 million Jamaican over the next 12 months. So once again, give generously, tell your friends about it. It's a worthwhile cause, and I think the people of Negril and its environment deserves good health care. And we can set the example for the rest of the island of what it is when a community bonds together and do things for themselves and not wait for government to do everything for themselves. So that's what I have to say. And in closing, I would just like to thank everybody for coming out. And we are very excited, and we are going to, like Mr. Grizzle said, we're going to let you know on a quarterly or monthly basis how the fund is doing. And we'll get there one step at a time. Thank you very much.
Thank you.
Now we will call upon a representative from the Negril Clinic to pass the vote of thanks.
Good morning.
Good morning.
Mr. Grizzle, President of the Negril Chamber of Commerce, Mr. Issa, immediate past President, and to all the other members of the Negril Chamber of Commerce, to my colleagues from the Negril Health Center, the Westmoreland Public Health Services, and the wider Western region, and to the citizens of Negril who are here this morning. Indeed, it is our pleasure to be a part of this morning's function. And as Mr. Issa has said, that Negril is an up and vibrant community that is growing. A lot of persons live here, a lot of persons work here, a lot of persons vacation here. And as we embrace Vision 2030, we want Negril to be front and center of that vision.
They're here.
And so we really want to express our gratitude this morning for what is being done by the Chamber of Commerce and other stakeholders. We applaud the different fundraising events, the Scotiabank Negril branch for partnering with us, Miss Brooks, the Woodstock donation, and all the other partners who have really walked the talk, because we say from time to time that health is everybody's business and the health of the nation is the wealth of the nation.
They're here.
But it's not only a rhetoric, an empty rhetoric, but this morning, by what has taken place here, the several checks that have been handed over, we realize that we are taking the talk for a walk. We are putting action. As we say in Jamaican, action, not a bag of mouth. And so we really want to commend the Negril Chamber of Commerce and the wider partnership for partnering with us in health to make the Negril Health Center one of the premier health establishments in the Western region and in Jamaica. If we do our job right, we will have an ever so decreasing need for hospital care, because prevention, primary prevention, is the way to go. And so once again, on behalf of the staff of the Negril Health Center, on behalf of the Westmoreland Public Health Services, the Western Regional Health Authority, and the wider Ministry of Health, we say thank you, thank you, thank you to the members of this community, the members of the Negril Chamber of Commerce, and all who have partnered and will partner with the different ventures that will help us to reach the goal of $150 million. It's possible. Together we can. Together we will. God bless you.
They're here.
Okay, up. I have a winner. That's an old trick.
That's great.
Hey, everybody.
Yeah.
Huh?
All right.
Okay. All right.
All right. Great. Thanks.
All right. Thank you, everybody.
Yeah, just send it to me by email.